Hello, nurses. My name is Jamla Rizek, and I'm an emergency and disaster nurse with over 20 years of experience, spanning from pediatric emergency nursing, disaster response, pre-hospital, public health leadership, education, and also national advocacy. I currently serve in multiple leadership and editorial roles focused on advancing emergency nursing, disaster preparedness, and global health initiatives. Throughout my career, I have had the opportunity to work in high pressure clinical and operational environments, respond to disasters and public health emergencies, and mentor nurses across different stages of their career. These experiences have reinforced my passion for supporting emergency nurses and strengthening our specialty for the future. I am seeking a position on the board of directors because I believe emergency nursing is at a critical point of transformation. Our nurses are facing increasing patient acuity, workforce shortages, workplace violence, and of course, a growing number of demands related to disaster and public health emergencies. At the same time, emergency nurses continue to show up. They continue to demonstrate incredible resilience, innovation, and leadership. I want to help ensure that emergency nurses feel supported, heard, and prepared for the future. I believe my combination of frontline emergency nursing experience, disaster response leadership, public health expertise, and organizational leadership allows me to bring a unique perspective to the board. My goals are fourfold. I would like to help strengthen professional development opportunities, help support nursing well-being, expand mentorship and leadership pathways, and advance emergency preparedness and response initiatives. I also want to help increase member engagement and ensure that the Emergency Nurses Association continues to evolve in ways that are relevant, innovative, and meaningful for nurses at every stage of their career. But most importantly, I want to serve as a collaborative leader who listens to members, values diverse perspectives, and this includes our international membership as well. I want to work to help strengthen the future of emergency nursing together. One of the greatest challenges facing emergency nurses today is workforce sustainability. Many nurses are experiencing burnout, compassion fatigue, and moral distress, all while caring for increasingly complex patient populations in overcrowded emergency departments. Emergency departments have become the safety net for gaps throughout the healthcare system. But despite that, emergency nurses are managing boarding crises, behavioral health emergencies, staffing shortages, and limited resources, while still being expected to perform high quality, compassionate care under this immense pressure. Another major challenge is preparedness for emerging threats and disasters. Emergency nurses are no longer responding only to daily emergencies. We are responding to pandemics, climate related disasters, mass casualty incidences, cyber disruptions, and increasingly complex public health emergencies. This requires ongoing education, training, adaptability, and strong organizational support. I believe we must continue to focus on supporting the next generation of emergency nurses, and we can do this through mentorship, leadership development, and creating healthy work environments that encourage retention and professional growth. Yet, despite these challenges, emergency nurses remain one of the most resilient and innovative professionals in healthcare. I believe organizations like the Emergency Nurses Association play a key and critical role in advocacy, education, preparedness, and ensuring emergency nurses have the tools and support they need to continue to deliver exceptional care to patients and the communities in which they serve.